Thank you, Madam Chairman, and thank you, Dr. Walensky and Dr. Shukat, for your service to the country and for being here this morning. Dr. Walensky, I very much appreciated our conversation earlier this week. And one of the things we talked about is the continuing challenge of the opioid epidemic that we're facing in this country. New Hampshire, like West Virginia, has been very hard hit. We are one of the 10 states in the country that's been hardest hit by the epidemic, and I was pleased that Congress provided some new flexibility to deal with the epidemic last year by including meth and cocaine as part of the drugs that could be included in programs to address the opioid epidemic. But can you talk, one of the things we discussed was the challenge that I've heard from providers in New Hampshire, that we don't have a response for those overdosing on meth in the same way that we have Narcan for those who have overdosed on opioids. Can you talk about what the CDC is doing to approach this issue and what kind of help you might have available for states like New Hampshire?
Thank you, Senator. You know, I'm thinking back to sort of 6 months ago and what we needed to do when we knew that one of our patients had relapsed and how we get them into care. And it was our community health workers that knew where to find them. They knew where they were getting their drugs and they knew where to find them and to say somebody cares for you and brought them back. And that, I think, is what we need in our public health infrastructure. We need the community workers who live in the community, who are from the community, to make those interventions to find the people. And that's really among the things that I think this public health infrastructure is going to be able to do. Certainly, we don't have something like naloxone for meth overdose, and that, you know, is unfortunate right now, and we need to address that. And then, quite honestly, we have statistics of the overdoses and the lethal overdoses. They're terrible, and yet we also have statistics of you know, all these hospitalizations that are happening among young people that I was taking care of just 6 months ago, 30-year-olds getting their second valve replacement. So this is something that we have to tackle. And it's not just that we have to tackle it with Narcan in a given community. We have to tackle it community by community because they're all different kinds of communities and we need the workers to be able to do so.
Well, thank you. I hope that, I know this is not a CDC issue, but I hope that you will weigh in if you have the opportunity with the administration on the importance of the set-aside funding for states like New Hampshire that have been hardest hit, because that's allowed us to set up a real statewide response to the epidemic. I want to go on to PFAS, which is an emerging contaminant until we get the EPA to designate it as something else, but it's one that we've seen very directly in New Hampshire, and especially appreciate the response from the Agency for Toxic Substances and Disease Registry, which has been so helpful in undertaking a comprehensive health study. And in New Hampshire, Portsmouth and Pease, former Air Force Base, have been one of the sites designated. But one of the things we learned is that too many of our members of the medical community don't have any idea about PFAS. They don't know what it is, they don't know how to respond to it, they don't know whether testing is appropriate or not. And I worked with Chairman Murray and Ranking Member Blunt last year to fund a grant program to help educate our physicians, and I'm very interested in how that unfolds and the work that the CDC might be doing to help and ATSDR to educate our medical community. So I don't know if either of you can speak to that on the update on where that effort stands.
This has been such a complex and challenging area, and I really appreciate the leadership that you've shown and the support you've given, and also the advocacy for us to learn what we need to learn so that people who've been exposed and the clinicians that they see know what to do. To get a result and then not know what it means and what you're supposed to do about it is challenging. So we really are incredibly grateful for the resources that are letting us begin to pave the way to get those answers. I don't have specifics on the results of studies yet, but I know it's a very high priority for ATSDR and the leadership here.
And do you have, at one point in the last year, there was a suggestion that there was a connection between exposure to PFAS and severity of COVID-19. Do we have any more information about that?
You know, I know that question came up and that we were looking into it. I don't believe we have a final, but we can get back to you if we do.
That'd be great, thank you. If you could just let me know, either way, what we know about that, I'd appreciate it. Thank you, Madam Chair.